The next one here, that's called the Shen Men. And the Shen Men is an important point for pain relief.
Acupuncture is a traditional Chinese medicine most commonly used to treat pain. Here at Clinic Community Health Center, that includes emotional pain. Based in Winnipeg, Clinic offers medical health care, counseling, and education to Manitobans.
Sometimes I will ask people if they want me to coach their breathing.
Kara Newstetter is one of 8 counselors at Clinic who are certified to perform acupuncture on clients' ears. She says most of the people who come to Clinic for counseling have experienced trauma, sexual, physical, or child abuse, suicide loss, or domestic violence.
There you go. How was that?
Good.
By inserting 5 little needles into a client's ear, Newstetter says she can help the person get out of those traumatic memories.
And alternative therapies get people out of the story and into their bodies. And that action helps people's nervous systems calm down. So people tend to feel more settled. They tend to feel more grounded and less anxious. For lots of people who are sort of revved up, sort of seem sort of wired, feel very anxious or apprehensive, the alternative therapies help them calm down in a way that's not re-traumatizing.
Because Clinic offers both medical and alternative therapies, Newstetter says personal belief systems can clash at work.
Staff and workers tend to feel a lot more apprehension and are more leery, where clients are like, oh, I want to feel better. So if you have something that will help me, I want to try it. We've struggled sort of at Clinic to find a way that feels respectful for all practitioners here when we're trying to integrate alternative therapies into our programming.
But alternative healing seems to be slowly making its way into the WRHA, the Winnipeg Regional Health Authority. There are multiple hospitals that provide holistic wellness services in Winnipeg, including the Spiritual Health Department at the Health Sciences Center.
We've worked really hard at bringing spiritual health into the mainstream of healthcare. We're embedded into the traditional model.
Kurt Schwartz has been a spiritual health practitioner at the Health Sciences Center for just over 10 years. He says his job is to provide emotional and spiritual support for patients and families while in hospital. That includes being there to chat, help patients make connections with outside resources when they leave, and directing people to the sanctuary.
This is the place where the spiritual health activities, most of the spiritual health activities happen in the hospital. It's always open to patients and families if they need a quiet place in the middle of the busy hospital to come to slow down.
It has equipment like rosaries to pray with, and there's sage and even ventilation to make smudging possible. The labyrinth on the floor is a meditative walkway that gives families something to concentrate on while they wait for their loved ones.
And where we're standing in the center is where it's felt the higher power can be contacted. When one is in the hospital or when a patient's family are waiting for someone who's in surgery, it's helpful to walk a path like this slowly and thoughtfully.
Schwartz is one of 10 spiritual health practitioners at Health Sciences Center. He says the hospital does integrate alternative health, but when it comes to things like herbal remedies and traditional medicines, the staff has to be cautious.
We try to encourage patients to consult with the doctors and the medical team before initiating any other specialized approaches that they might be interested in because of potential drug interactions.
So where does the staff go to relax? This is the Relaxation Center. It's a room open to staff 3 days a week for de-stressing, any way they like. Holistic healing is on the menu with things like hypnosis, reflexology, polarity therapy, and Reiki. There are even devices to help relax, like a thermal heat massage bed. This is just one example of a Winnipeg hospital that's beginning to integrate alternative and complementary medicines, but Schwartz says there's still a way to go.
As we look forward into the future, I would like to see that we embrace whole person care here at HSC, which means that we take the person and their holistic needs, all of their needs in mind when they're looking for the help and the health that they need.
To help him through his work at the hospital, Schwartz wrote and published a book in September 2015 about his personal journey with alternative healing. This is an excerpt he wrote in May 2006 after helping a woman in care.
You may be a Buddhist, Hindu, traditional Aboriginal, gay or lesbian, exploring different aspects of spirituality or of no particular path at all. At a common basic level, there are many things that we find that we share in common. Values of compassion and understanding, that we are brothers and sisters on a common journey through life's ups and downs. I experience your need, your anxiety, in the wringing of your hands or the quick darting looks. The tears that begin to flow as you tell your story. I have no answers to give you. I can't take away the pain either. But what I have to offer is my presence and my compassion. In walking this common journey that we call life, even though there may be differences, I hope that you will know that you are not alone.
Join me next week to meet a few Winnipeggers who are breaking down the stigma of alternative therapies. I'm Samantha Sampson, and this is Meta Medicine.